All right, thank you everyone for joining us here today. We're very excited to have another webinar in our Operationalizing Locally-Led Development series. This is our May event on locally led capacity strengthening, and we are very pleased to have a wonderful panel here to speak to you. Before we get started, I'm going to go over a few housekeeping notes, and then I will hand it over to our moderator and get things started. So first, thank you for joining us, and thank you to all of our industry partners for the support that they give to Humentum and our community in providing their expertise to all of us. You can see here we have some upcoming webinars. We have another series going on diversity, equity, and inclusion, and we'll be hosting a webinar with FHI 360 on decolonization. And then we have a members-only conversation with USAID and a webinar on duty of care and corporate travel. I will drop a link to all of our upcoming events in the chat, and you can take a look at what we have on the schedule. And then lastly, a few housekeeping notes. First, we love questions, we love discussion, especially for this series. So please do use the chat to comment, question, add your thoughts. We want to see what you're thinking as we go through this event. And if you have any technical issues, you can message me privately. My name is Jessica Walker in the dropdown, or you can message Helen Marasamba. She can also assist you in taking care of anything. In terms of subtitles, we do have those available for anyone who would find them helpful. You can click on the captions or live transcription button on the Zoom toolbar, and that should activate those for you. Please do not update the language in that, as we will all be speaking in English. It is set so that the captions will be correctly captioned. And then we are recording this webinar, so you will receive a follow-up email with the recording on Friday. So keep an eye on your inbox on Friday morning, afternoon, or evening, depending on where you're joining us from, and you'll have access to that. And you're welcome to share that with any of your colleagues as well. So with that, I am very pleased to hand it over to Humentum's Director of Community Strategy, Kim Kaczynskis, who will get us started.
Thank you. Thanks, Jessica. Thank you, everybody, for being here today. Very excited to get started and jumping into this conversation on capacity strengthening. If this is your first time joining one of these locally led development webinars, let me just give you a little bit of a background. Humentum is part of this movement for equitable development, and we bring a unique perspective on how to bridge the gap between the strategy and kind of the high level thinking and real practical action, and how we are making operational changes for a more equitable, a more resilient, and a more accountable sector. And so this locally led development webinar series is part of that work. We also have a number of other pieces of work, both research findings and reports that you can find on our website, and I'm sure Jessica will put the link in the chat. Our latest report is on the ERA index findings, which is a survey that we did last year, and there's some really interesting results that you can find there. As far as this webinar series, we are about 18 months in. We've been doing a monthly series ever since the start of last year. To start off this year, just a few ones that we have been doing recently. In March, we had a conversation around equitable partnerships. In April, we were talking about NGO perspectives on locally led development. Today, we're talking about capacity strengthening. And if you're interested in what's going on next month, we have a session called NGO Leaders on How Investing and Operating Models Can Impact Locally Led Development. So all sorts of different angles on a similar topic. And I think if you're here today, you will likely be interested in the June topic. So we encourage you to register for that one. Last year, we were getting started on this conversation. We were really all about the talk. What are the big topics? What are the big themes that we need to start to grapple with as a broader community? This year, we're about how do we move from the talk to the walk? How are we implementing the changes that we want to see. And so really what we want to be doing is showcasing models and examples and pilots of what folks are trying out. What's working, what's not working, how can we be learning from each other? And so today's conversation really is just going to be, it's going to be a frank conversation, an informal conversation about the topic of capacity strengthening. And I'm really excited to have this conversation. We have 3 sets of relationships that we're showcasing here today. So we have JSI and ProLink, Africa University, and the Joint Clinical Research Center, who have worked together on 3 different projects respectively, but that all center capacity strengthening as a key component of their locally led work. And so they'll be sharing what they've been doing and how they have been working together. And then underpinning all of that is JSI's work. They have an overarching approach to capacity strengthening and to technical assistance. And so that's called the Reimagining Technical Assistance Initiative, which outlines 9 critical shifts to improve both technical assistance and capacity strengthening. And so that's kind of a framework that underpins all of these different approaches. So let me go ahead and introduce our panelists. We have Edem Assisi, who is the executive director of ProLink. We have Mounia Msefer, the deputy project director of the TIFA project for JSI. We have Dr. Mugomeri, the chief of project at Africa University, and Dr. Cissy Kityo Mutuluza, the executive director of the Joint Clinical Research Center. So they are all going to be joining us and having a bit of a chat about the work that they have been doing. So please, I think we can bring you all into the pinned conversation, and then let's go ahead and get started. Lovely to see all your faces. So let me go ahead and get started. Mounia, my first question to you, and maybe it's just setting us up in kind of this, I like to think in structures, and I like to think in kind of the broader background of where we are all sitting. And so tell me a little bit about JSI's philosophy and your approach to capacity strengthening. And maybe if I may lead the question a bit, I have long been a fan of this approach. I think there's a lot of common sense in it, and I think you're hitting all of the right marks on the 9 shifts that you are talking about. As I was looking at it the other day, I was seeing a number of the 9 shifts that you're talking about kind of embedded in these different projects we're here to talk about today. I saw co-design, I saw capacity strengthening, I saw contextualizing approaches. Am I missing anything? How does this framework inform the work and the different projects that you have been doing?
Well, thank you, Kim, for having us today. Yes, the JSI approach for capacity strengthening is based on a set of principles, which are very much part of the Reimagining Technical Assistance Initiative. And they're the key principle for me is how we work with our partners. We believe that partnership should be based on mutuality, and that means understanding that we all come to this work we all with something to bring, and then we don't, not one person has the answer. And so it's really is about sharing learning and knowledge. And in practical terms, the way we do this is that we take the time at the beginning of the process to get to know each other, understand what the priorities of the partners are, and really jointly develop the objectives for the engagement. And one aspect of this that I think is critical, it's being open about our mandate as the INGO that comes in with a capacity strengthening mandate, is that we have to be clear, but the funder, with the partner, we have to be clear about what the funder is asking us to do and what we will communicate to the funder, to them, the confidentiality aspect of it, so that we kind of set the stage from the beginning. And that's also a way to address this power dynamic that exists between funder and grantee. And so that's a critical aspect of our approach. And especially on TIFA, that's something I've very much experienced working with governmental entities. And that's been a very, it's been really important for us to address that from the beginning. The next principle that we believe in is that we should be flexible and be willing to adapt to the context. And so that, that comes with working together to co-design the engagement. So we have to be flexible in terms of the tools, the modalities, the engagement, who are we going to engage? And that really helps, us focus on what the organization needs are. The other aspect of this is taking a systems view. We recognize that the organization does not operate in a vacuum, and so we know that they have to deal with this complex external environment and those power dynamics that exist. And so often there are external factors that may impact their performance. And so understanding those from the beginning, understanding who the key stakeholders are, what some of the challenges are, is very important in setting the stage for the capacity strengthening process, especially the capacity assessment, so that when we come up with potential interventions, we agree on those that would support the longer term and sustainability aspect of the organization, rather than perhaps proposing something that may ultimately harm and may not be sustainable. So that's just kind of generally our approach, and that's very much part of also of the reimagining technical assistance concept as well. In terms of this, the concept is and how we've used it at TIFA, at JSI. On the TIFA project, for example, we've used it to assess how well we were doing given our mandate for country ownership. And so with the RTA team at JSI, we identified two critical shifts that align well with our scope. And we had several brainstorming sessions on those shifts. And one of the ones that we were looking at whether how well we were aligning to country priorities and decisions, and how we collaborate to create this relationship based on trust and mutual accountability. And so we asked ourselves some questions. Are the NTPs, can we do more to help to assist the NTPs in really taking ownership? Are there things that we should be doing differently? And then also things like, how does TIFA promote government and community ownership and really leadership of the program and coordination? Are there things that we are doing without thinking about it that may not necessarily support that the best way? And so we're really brainstorming on this internally. And right now we're at the stage where we're looking at our next steps, trying to identify where we want to move, where we want to make changes, and how we want to move forward. And that was an interesting result, because we always thought that by design we are country driven as a project, but we realized that there's always room for improving things in our work.
Thank you for that. And I just dropped the link in the chat for those who are interested in the framework. And I'm going to ask you this question because it's probably top of folks' mind. And you're mentioning, I think, all the right things, which is saying we're taking the time to have the conversations, we're doing the co-creation, we're thinking about what our joint mutual goals are, et cetera, and priorities. That all takes time and that all takes resources. So how is this capacity strengthening work being funded, and how long is that kind of front piece of the planning and the design? How long does that take?
So our capacity strengthening work is mostly funded through donors. That's the reality of it. But we do, we've also invested in some of our local affiliates to work with them to strengthen their capacity and really being able to take on the work. So that's where the funding comes from. What was your other question? Sorry.
Just the length of time for that kind of co-creation piece at the start, especially as you're in the partnership perspective.
Well, I guess it varies, but we do want to have a session where we do meet with the partner, and before we dive into the capacity assessment process, right? Taking that time to meet with them, have a workshop, have a session to brainstorm on what their objectives are, and then doing our due diligence ahead of time to prepare all of that. Kind of understanding a bit more about the organization, then having that meeting with them to jointly work on what the engagement would be, and understanding what the objectives of the organization, then going back and really, adjusting our tools and process for that. So that takes a bit of time, but we think it's worth it, right? So.
Thank you for that. So yeah, I'm interested. I think that's a really interesting kind of background and framework on how this all sits, where this approach is coming from. Cissy, Elton, Edem, I'm interested to hear from you all. a little bit about your relationships with JSI, where it started, where it's not, where it is now, and how you all have worked together. And I'm interested in hearing from you, what is the impact of this relationship and the projects you have been working on, Ben? Both the good and the bad. How has it changed how you work, how your organization is doing its work, and maybe your future plans, depending on your individual situation. So I'm happy to let whoever wants to speak first jump right in.
Okay, I'll jump in.
Thank you.
We've been working with JSI for the past couple of years, and our relationship really started with an arrangement set up by USAID, where they gave us a sub-grant with JSI as the prime. So we did do this. It was mainly looking at community linkages to health facilities in the PEPFAR program in the northern part of Uganda. And in this period, which was 3 years, it gave us an opportunity to work closely under the supervision of JSI and its team, and give our results for JSI as the prime to report. So this working alongside JSI gave us then the opportunity to, first of all, learn the region, because we hadn't worked there before, but also learn how they were implementing. So it was a mentoring process to get us to be the prime in this region. And before we actually got the prime award, JSI used USAID tools to assess the capacity of the institution and also the risks in the institution. And all this was deliberate by USAID, but also JSI to lead on to being the prime in this region. And so based on what they found, we worked with them. We had a plan to work on the issues that were identified so that we address them. And then when USAID was okay with that, they gave us a prime award. But even with the prime award, everything was not transitioned. JSI remained with some tasks in the region. And the main thing was that they work alongside us. So now we were a prime, but we're working alongside JSI to implement a complementary program in the same region, but again, for JSI to continue to provide oversight and technical support. And we knew, all of us, all the three partners, that we had to sustain the gains and the results that JSI had achieved in the region, but at the same time, we needed to even exceed what they had actually achieved. And we are doing wonderfully in the region. And right now, all the other aspects which had remained with JSI are being transitioned to the JCRC as the prime. But alongside, as we did this, the technical support was also very intentional. And we had regular meetings with JSI, but also USAID. So USAID was still around the table to listen to what we were doing, how we were transitioning the staff from JSI, how we were also transitioning the tools and what best practices that were transitioning to make sure that we continued to achieve what we did. And so this process has slowed down, but I think there has been a lot of gain that was achieved through this. And where are we going? So we have a stronger institution because of all the capacity and the systems that have been strengthened in the institution. We are prime already in another region, but in this region we are new. So all the systems, while they were meant for this project, they overall strengthen the whole institution. And because now JSI knows what JCRC is, we have bid twice as partners for new grants. Unfortunately, we didn't get them, but I think there is still room to work together because they know what strength they have supported within the institution and they know what we can achieve. So we look to moving together in terms of implementing as equal partners with the strength that has been built.
Thank you for that. I have many follow-up questions, as I'm sure others who are listening do. So feel free to put your questions in the chat. But I want to get to both Elton and to Edem. So maybe Edem, if you don't mind going next, yes, please do.
Thank you very much, Kim, and I appreciate the opportunity to be on this webinar. ProLink is one of the oldest organizations in Ghana in terms of KP work, and our journey with DSI actually started in 2016 when DSI, won an award with the USAID to implement the care continuum having to do with key populations in the country. At the time where the integrated biobehavioral survey of the country highlighted that key populations were the major drivers of HIV infections in the country. So ProLink and a couple of NGOs numbering about 10 actually wrote the proposal to DSI, got selected. So the beginning of the whole process was a self-assessment tool that was deployed by DSI to the various organizations that qualified, including ProLink. So we did that. And then you will get to know the gaps in your own organization. And DSI is now going to help you, to address most of these gaps. So I put the capacity enhancement in terms of governance, in terms of finance, programming, and so on. The main focus of the relationship that we have with DSI, one, enabled us to have a seamless, engagement with the Ghana Health Service and major stakeholders in the country. That is a very complex institution, government institution to work with, because for a long time they have been used to, working alone without NGOs or partners. And it took DSI's, very good acumen in engagement of stakeholders for us to also be able to break, that jinx. Aside that, in terms of our policy documents, JSI, was able to help the organization to put together HR manuals. In fact, we actually got an embedded advisor here at ProLink for about 3 months, and that person actually assessed the entire organization and helped us to fine-tune all the policies that we were working with. And even our board, the board charter, all that got reconstituted. At the time, I wasn't the executive director. I was head of programs. But I want to say that, climbing to become the executive director of ProLink today, I actually owe it to DSI because at the point, Kumkum, came for succession planning capacity workshop here in Ghana, and I was part with one other colleague. And through that, we were able to put together a succession plan. And then when my immediate boss exited, it was not a problem at all for me to transition to begin to lead the organization. So ProLink has been with JSI down in the South for 3 years up to 2019. And then we continued with JSI to the Western region for epidemic control, again on the care continuum. We are still with them, even on the global vax currently. Now the scope has been expanded. ProLink remains one of the most credible partners to JSI in terms of our capacity. We are in 10 out of the 16 regions in Ghana. So, and that should tell you the work JSI has done, on ProLink from our systems and that has qualified us, to also become sub-grantees to other organizations in the country. We have actually managed the Communicate for Health with FHI 360 and also sub-granted another organization. All that we did, with the support and the skills, the capacity that we received from JSI, without which we couldn't have done that. We have actually led a group of NGOs in Ghana to apply for the APS while partnering JSI. And it was very surprising that we kind of got selected, our concept got selected, and we had to now sit at the same table with JSI, who actually trained us. And it was exciting to be in the same room for the co-creation with USAID. We are still on that process. And we would like to thank JSI and say that, yes, it is promising. We want to continue, our relationship with JSI and continue to learn a lot more, because one of the things that we think they have done very well is giving us a lot of capacity, but we have not actually moved beyond the capacity that we have received to begin to manage other sub-grantees, on large scale. So we would like to continue the relationship. As the questions come, a lot will unfold, and then I will speak to the issues. Thank you very much.
Great, thank you for that. Thanks for that background. And then Elton, would you like to share? So tell us a little bit. What's your relationship with JSI? How has this gone? How is the different projects? Maybe how is your approach, the approach of your project different from the ones the others have shared?
Okay, thank you very much for this opportunity. So our mandate has been at Africa University in Zimbabwe. Africa University is a private institution in the country. Before we started collaborating with JSI, it had already implemented the Center for Clinical Research had already implemented some objectives with some NGOs. So when we came in for this particular project, alleviating the problem of TB in the country, we actually had very little experience in terms of TB programming from our end. So what we did was to work with the National TB Program and JSI in the first project. We actually did a core development of the concepts. We developed, I think, a number of them, about 4 at first, but now we are in the 11th objective. I think the total value that we've worked on is around 1.6 million. Yeah, I can say from the start, we knew that we were working with the National TB Program under the Ministry of Health. It's a very complex organization with, in most cases, it's a top-down approach. And I would say generally things are centralized to a greater extent. So getting decisions made, I think at lower levels, even some of our teams, I think they sort of have been facing some challenges. But we have been, I think our strategy has always been communication, that is Africa University and JSI, and then Africa University and then NTP, and communication, constant movement of information from across those organizations. So I can safely say we have somehow been able to implement very key objectives that were already in the national strategic plan of the ministry relating TB. I think I would say of the 11 objectives, about 8 or so have been pretty much a success, particularly the Making Sense of TB program that we implemented to enhance coordination of national TB epidemiological data quality indicators. Then the TB Research Technical Working Group, which we also implemented to develop the national TB research agenda. And also recently we have been also doing capacity building for TB operational research. And we also did the development of the TB Echo, which we have been implementing since around 2020 December. So this has also been another success. Then the DRTB Concilium and TB Expert Committee, as well as Train Smart, those three, they have been very slow to implement due to some logistical challenges, as well as some structural challenges that we have noted within the National TB Program. The most recent one, the Quality Improvement Program, I think it has also been a very exciting project to the National TB Program. However, we have just started. We are yet to see its success. So I would say the pace of implementation was generally okay, but slow at first. It was, yeah, at first we could see that things were a bit slow, but there was sort of a pickup in our implementation pace. And then where we are at the moment, I think in the third year or so, things have started to slow down a little bit. This, we think it could be due to the number of officers that are implemented to carry out certain tasks and the competing priorities they have to work on. We have seen that this sort of slows down the pace. I think in terms of our own side, I would say the AU administration, I think it was sort of 11 objectives is quite a challenge. They have also faced some challenges, sometimes processing for job placements for TIFA. It has been slower than we actually wanted, and that sometimes slows down the pace of completion of the objectives. Maybe lastly, I would say in terms of our mandate, which was working on fixed amount awards, I would say these are very, very important. We have seen that in terms of implementation, we're implementing everything that was in all our implementation was extracted from the National Strategic Plan, which means all these objectives were actually coming from the NTP itself. Despite some limitations in the funds, we still would say that the NTP has lent a special skill, I think, on prioritizing as well. Okay, maybe one last word just to say the AU team, I think, is now well versed with developing priorities. To date, we have just received a request for us to sort of host some grant, and we're still working on this, but we take this as an important complement on our work. Thank you.
Thank you. Thank you for that. Thank you all for sharing. And I'm hearing both different approaches in the ways that your projects are set up and the goals and the methodologies of the different initiatives. And yet there's a few commonalities that I was hearing as well. Cissy, you mentioned, the fact that USAID was there alongside JSI kind of the whole way. There was a high level involvement and there was a high level of intentionality and being really deliberate about this is how we're going, this is what we want to achieve and where we want to get to. And then these are the different ways that will include learning and capacity strengthening along the way. I'm wondering from all of you, and Mounia, the same for you as well with JSI's experience with different projects, is this normal? I heard from you, Edem, something about the fact that you all are focusing on organizational capacity versus kind of the technical capacity. And I think that's something that I've been hearing in many of my other conversations with different Humentum community members as well, which is oftentimes when we talk about capacity strengthening, it's about technical capacity strengthening, not organizational. And yet the impact that I'm hearing from all of you in the trajectories of your organization is related to the capacity building or strengthening of your organizational priorities, et cetera. So is that normal? Is this what you're seeing across in other areas of your work, or is this fairly unique? And if so, what's the impact? What has the impact been? Big question. Yes, Cissy, please go.
Yeah, I think the main goal of USAID working with international organizations like JSI is to build the capacity of the local entity so that it can implement the program of USAID or PEPFAR or CDC. However, what we have seen happen, especially when the capacity assessments are done, is the issues that may come up are very important for you to deliver the program, financial, capacity, or even sub-granting. But these capacities, when they are addressed, and I know USAID has really gone an extra step, they incorporate the whole institution as an organization and systems. While these systems enable you to deliver the program and do it very well according to policies and regulations of USAID, these inadvertently strengthen the whole institution. And while you're able to handle, because PEPFAR grants are not small, we are handling a grant which is about $38 million US. Other institutions may handle more. But handling that kind of money with systems that have been put in place makes you very attractive for other funders who are not necessarily PEPFAR. And also the systems that have been set up show, and USAID works with you, the partner like JSI works with you, and then you are set and ready to receive other funding from other organizations. So I think overall, this leaves the institution as a very strong institution. And this is what is also, I think, underlying the sustainability of the institution, because tomorrow maybe you don't have USAID funding, but you can get other funding because you have the systems, and then you are credible to other funders because you're handling this amount of money and you're handling it and doing it properly. But also with respect to the program you are delivering and the results are there. So I think overall, this capacity strengthening is very important for sustainability of local organizations. And some aspects that could be improved is, I think when JSI, for example, comes, or USAID, they have their set tools and they know what they want to do. It's not very common that they're asking, what do you need as an organization to improve? And these may be small things like, for example, JSI, we've worked with them and I see their reports from the northern part of Uganda where we work. And their reports are so good. And this may seem simple, but also if you don't give a very good report to USAID, you may be in trouble. We do a lot, but I don't think we don't know how to package our results properly and present them nicely. That is, it may seem a small thing, but it can make a whole difference in terms of how you're viewed by your funder. So I think maybe the capacity strengthening in terms of what do we need to strengthen should come from both the local organization, what they see. You come with what you need the organization to improve, but what does the organization see as areas that need to be improved so that you can help them also in those aspects, in addition to your toolbox and list.
So how do you open up the space for other things that maybe, I don't know what I don't know about what you need? Yeah, that's a great point. Other thoughts on that? Is this type of...
Can I just
yes,
jump in?
please.
Yes. So I think from the angle of JSI's support to local NGOs, we are looking at a holistic, like Christy said, holistic capacity enhancement. So there are requirements that cut across a myriad of donors. So JSI's anticipation is that they want to qualify you, prepare you, grow you enough to be able not only work with JSI, but work with other donors. So for instance, due to the benefit that we got from JSI, we are one of 2 organizations working with KPs on the Global Fund NFM3. We have been on the NFM2 and transitioned to the Global Fund NFM3. And that has also enabled us to move and work with UK8, formerly called TIFA. So the capacity enhancement comes at the organizational level and qualifies you, prepares your systems robust enough to be able to attract other donors. And then programmatically, that also prepares you, because JSI is coming with, capacity enhancement in the areas of programming, such as specific strategies that you can use in the line of work, because we are working with key populations, strategies like index testing, social networking. These are things that are akin to JSI, and they will train you on the tools, data tools, monitoring and evaluation, Now, one of the things that we think JSI should improve upon is the capacity to document properly. They are able to do it so well at their level. Here in Ghana, the care continuum churns out monthly briefs. We need capacity, like Christine was saying. Projects should be able to even pay for communication advisors within local NGOs, so that once they train that, and then it will enable us to have a department for documentation, because we have done so much, but we are not able to capture it properly and sell ourselves out there. So that's just a bit I want to add to what Christine has put out. Thank you very much.
No, that makes sense. I mean, language, communication, all of that is such an important piece. Mounia, did you want to add?
To your earlier point about providing both technical capacity strengthening and organizational capacity strengthening, that's something we've started seeing a few years ago. We had, there are some projects that really just focus on organizational capacity strengthening, and the technical aspects are handled by somebody else. And so we've seen that the donors realize that that aspect is also important. With USAID and their regulations, there's a lot to to manage and to make sure that we comply with. And that part may not be, we're all learning. I mean, things are evolving every day when working with donors, and so that's part of it. And we've seen this being incorporated more into USAID proposals. But there are cases where it is mostly focused on reaching those objectives, the targets of the technical aspects, and sometimes it's harder to bring that that complementary support as it relates to project management, organizational management, and things like that.
And when and I think that's a really interesting point, and I'm sure there are others on this call who are grappling with that as well, where there's an emerging acknowledgement, maybe we're a little late to the game to acknowledge this, that the organizational resiliency is going to be important for in order to achieve all of the things that we need to, and yet the current funding system is often based on outcomes, technical assistance, this type of thing. How are you?
Kim, can I just
yes, please.
So I just wanted to say that sometimes the support coming from JSI is not only organizational, it can also be logistical, and the point I want to emphasize is that JSI is a listening partner, because I remember we got to Western North and the terrain was so rough. And I told them that, okay, we have a lot of hard to reach communities here, and we are unable to reach the female sex workers and the men who have sex with men. So they asked me, what do you need? I said, I need motorbikes. And within months, that was provided, and it's actually reflected in the kind of results that we wanted to see. So sometimes it's the ability of the donor to listen to you and ask you, what do you need? Like Christine was, putting across. That's just the point. Thank you.
Thank you. That's a great point. What I'm hearing there is kind of this thread of what real true partnership looks like. And I want to kind of come back to that because I think it's such an important piece of it. But I wanted to pull one other thing out that you mentioned, Mounia, and that's this tension between kind of what we want to do and what we are able to be funded for. And I know that, with your with the framework that you're looking at, with your reimagining technical assistance, initiative, the idea is, I would imagine, well, actually, I want to ask you, what is the goal with your idea of capacity strengthening? Is it to cede power and responsibility as much as possible? Is it something different? And where are you coming kind of up against barriers with the funding models?
I mean, the goal for us in capacity strengthening is to that lead to better outcomes, right? That are more sustainable and we know that the system, the industry is not really set up for that, for the programs to be locally led. And we think that capacity strengthening can help address some of that, can help kind of mitigate that dynamic with the funder from that aspect. So.
Elton, do you want to add?
Yeah,
Please.
yeah. I just wanted to. I think it's most of the things that have been said already by Samuel. They sound almost the same with our situation. But just to add that, sometimes there are unique challenges in countries. I think Zimbabwe is one of them. Sometimes the challenges, they change from time to time, and sometimes pretty fast. We have seen that the capacity to absorb the shocks when they happen, if we are not able to move at the pace that is unfolding, it pulls the project back. So what are these challenges? I think currently the country is facing a huge challenge with I think it's inflation. I would say it's a big problem. So the demotivation of the government workers is one big challenge. And sometimes when you are trying to do certain things or to implement a certain objective, you start to see that you are facing this challenge. So these are some of the things that we've been trying to work around to see how can we come in and help. I think JSI at some point was even able to assist us to have some interns that then work with the NTP just to bridge the gaps where there are shortages of workers, and so that at least even the NTP can also see that when work is moving this way, you get the results. Maybe in future they are able to internalize those particular individuals. Thanks.
One thing I would add, Kim, to what Dr. Mugomeri mentioned is that with TIFA we award fixed amount awards, and that is in some ways, it focuses on outputs, TB outputs in this case, that have been agreed upon at the beginning of the grant. When we're co-designing the grants, we agree on milestones, and then we are kind of step out of the way and let the implementers manage. And I think that is a mechanism that helps the organization mitigate some of the challenges with donor compliance, because they still have to have strong systems and everything, but there's less reporting, less administrative reporting, financial reporting. There's fewer approvals to get because everything has been negotiated up front, and then the grant recipient can make whatever decision is necessary to move forward. So with AU, we can work with the national TB programs to implement the best way that they see fit, as long as the agreed upon milestones have been reached.
Cissy, did you want to add something?
I just wanted to add that something that I don't see happening that should actually happen. I know there were links put in the chat, but when this, again, it's documentation about what capacity have you built in this organization so that it is known, and then even the organization can see how to extend that. So that tomorrow, if it is another organization, we are not starting from scratch. No, because capacity has been built. I think that documentation, what capacity exactly, because capacity is a very big word. What capacity exactly has been built, and so how are these organizations running with it and building on it. And then, of course, again, which I think requires documentation or even putting in practice, part of the sustainability is if you have built capacity over local organization, in whatever aspects, because capacity is big. They should be able to build now local for local, the smaller ones. And so it shouldn't always be international NGOs because you've built capacity. So is this capacity being passed on to other organizations so that they can also perform to a certain level? Yeah.
Yeah, I think that's a great question. And you brought up a few different things, Cissy. One is, capacity, the language that we're using, right? The term capacity and the term capacity strengthening is a very broad term, and many people interpret it in many different ways. And I will be honest with you, even as we were putting together this panel and this webinar, we were thinking about language and what's the best use of the term. I don't know that we as a sector have landed on the right terminology for what this means, but language is important and it matters. And I think we landed with capacity strengthening because I think everybody needs our capacity to be strengthened. And I think it's a two-way conversation. All too often when we think about this, capacity building or capacity strengthening is unidirectional. It's one direction. I'm interested to hear all of your thoughts on the role that this can play, the experiences that you all have had in building trust-based, sustainable partnerships. In other words, how can capacity strengthening, when done right, be a tool in our kind of toolbox to build these real long-term partnerships based on accountability and mutual trust? But on the flip side, if done wrong, how and what are ways that it can cause harm or damage? And where does language play a part in that? It's a broad question. I'm interested to hear your thoughts on it. Whoever is interested, whoever wants to go first, please just jump in.
Yeah, thank you very much. I just want to jump in again. Capacity strengthening, capacity enhancement, for me, I think is really a matter of semantics. Before even we start to enhance some capacity, there is some level of capacity available. So it can only be strengthened at that point because recently when we moved to the Western North region, the reports of the region actually suggest that HIV knowledge among health workers in the region was very low. And JSI was the first institution that was taking, a KP program, HIV program to that region, which was newly created, So that was the point where we have to now build capacity because, some of the health personnel have just come out of school fresh and have not been exposed to any knowledge about working with key populations, really. In that instance, you can build. But in another instance, they have some knowledge there, and you can enhance it. So at that point, for sustainability's sake, it is always important to include or involve the stakeholders because like we have it now, we are transitioning or leaving most of these communities. And if we hadn't enhanced or strengthened the capacity of the health workers, so who are going to own the project beyond, June this year, we don't know whether we are continuing as yet. So yes, my thoughts are that, yes, you can choose to build capacity when you have, evidence that there isn't any capacity, but by and large, you can just decide to strengthen or enhance capacity. Thank you very much. Those are my thoughts.
Thanks very much. Other thoughts?
I mean, one thought I have is that I fully agree with the terms and the fact that capacity exists and that we should be saying capacity strengthening or enhancement. But sometimes, we've seen that donors are not quite, we don't see those terms in requests for proposals, they're not, some of them haven't caught up yet in terms of the change in landscape. And so that's, as an implementer, you have to respond to what the donor says, but then you have to also, establish that wrong relationship with the partners. So that's a challenge for some of, in some cases.
Yeah, so the capacity strengthening, enhancement, or whatever we choose to call it, should be bidirectional. And because sometimes you find we are the people on the ground, we know the context of where we are working. And then we have this international NGO and, it is coming to build your capacity. I think the learning is two-way. And that is, I think, what we call capacity. But at the same time, we should really be focusing on a more comprehensive capacity strengthening for sustainability. Because you do not want to go away and then a local organization you've been working with is not able to continue because you're not there. Your success is the continuity of that organization you've been working with. So absolutely, even as you talk to all of us should be talking to funders and saying, this is for the good of the overall of the organization for sustainability, because this is how we are going to strengthen our health programs in the country, whether we have international NGOs or not.
Elton, did you want to add?
Yeah, pretty much the same. Not much different. I think I would say just to agree with Cissy.
Thank you. And sorry, Mounia, I saw you unmuted.
Yeah, I 100% agree with Cissy. One of the things that I wanted to say is that, we talk about being capacity strengthening, being locally led, but I think that also includes having those interventions, capacity strengthening interventions being locally led. So the INGO coming in with people externally doing this, there's a better way to do it, to really bring on either local partners who can actually do the work, who have the capacity and who can then help, probably most likely much more efficiently that we can do as an international NGOs come in and they understand the context and understand the environment. And so have a group of local partners who can actually do the capacity strengthening. And at a minimum, have on our team, if, we bring on staff, have people who speak the same language, who understand, have similar experiences, similar backgrounds, so that, there's a better understanding, than somebody coming from outside. So I fully believe in that.
So thank you for that. And let me ask you this, and if you are listening and you have questions about what this means, how this is all being implemented, please feel free to put your questions in the chat. We can start a discussion there. But my question, I guess, for you all is this work contributing to shifting the power, or how is this work contributing to shifting the power to local organizations? And if yes, how is that happening? And if not, how can we go farther? What can be done? And my assumption is we're going to talk a little bit about what role the funders can play, but there might be other factors as well that you all have ideas. Having gone through this process, is how do we take this farther? So I guess, let me just say, the first question is, has your participation in these capacity strengthening programs helped to shift the power to local organizations? And how do we do more? Adam, go ahead. Yep.
Yeah. Okay, so I want to say that yes, power is shifting gradually. Up until this year, JSI has actually identified, I think, 4 organizations whose capacities are up there, including ProLink, and has actually gone ahead to elevate their status to contractor levels, and has actually partnered ProLink during the 8 years to USAID. So that should tell you, donors are beginning to recognize, the capacity of various local organizations and are beginning to align themselves. In fact, during that call, more than 10 international organizations contacted ProLink to partner us. And that should tell you that, yes, it is because they have seen something about ProLink. It is because they have seen that you are working with several donors and your systems are robust enough to be able to, attract funding from USAID directly. So power is shifting, but not so fast. It is a gradual process. And I think up until this point, JSI should continue to play that mentorship role. Like Cissy said earlier, we are not there completely yet. I'm speaking in terms of, say, Ghana. Most organizations are still not there yet. So big donors like JSI need to be around and possibly play that mentorship role for some time before eventually, because I know USAID, as part of their policy, they are supposed to be going local at some point. So big donors also have all this at the back of their minds, and they would like to, kind of play, some role in the scheme of things, just in case one of their own becomes a prime in the future. Thank you very much.
So I think, just like Adam said, the power is shifting, and it has to shift because this is the way that PEPFAR has agreed to move, localization. But when we talk about localization, how then do the local organizations handle the increased funding and able to deliver on programs? So JSI has been playing this role of transitioning to local organizations, and I think it's already happening. For example, where we are working in the northern region with JSI, they are handing over completely all the PEPFAR aspects to us as a local organization. And I think the issue is how many organizations, even in one country like Uganda or Ghana, are being supported to build this capacity to take over. Do all of them have to be assisted by an international NGO? All those organizations that have been supported and are now priming, how then are they capacitated in terms of funding so that they can build capacity of others in the country, so that it is a trickle-down effect? But that is also to show that you have built enough capacity and confidence that these local organizations can then support others that are local. Otherwise, yes, the shift in power is happening. And sometimes we will find ourselves as primes, and our subs will be JSI.
Okay. Yeah, from our side, I think I would say Africa University is, through this support from JSI, we've worked with, I think, around 15 people now that have been capacitated at Africa University. Yeah, that's quite a huge number, because these people could become a sort of mini projects in future. And two of our people, I think, managed to advance their studies in the areas of finance and research administration. And I would want to comment that research administrators in our region are sort of not many. So just building one or two here and there is a huge achievement. We have seen that through this, the same individuals are already in demand, and they've been working on other projects. So there is some slow movement towards making use of the capacity that has been built at Africa University. We have also seen that there's been of late there has been interest to work with us on I think on one or two internal projects in the country. So this is something that we think is evidence that there's some capacity built at the institution. In terms of the National TB program, yes, we have seen that they've learned the prioritization process, and they continue to also receive other grants. It's also testimony that they have, people get more confident to work with them if they've worked with other organizations. Thanks.
Thank you. So it sounds to me like there is progress being made, and then the big question we need to start grappling with is how do we start to scale that, which I think is a conversation I've been hearing in many different corners and different groups. And Cissy, I like your question of how do we scale? Does it have to be this trickle down? Can it be, how do we make it more horizontal? And a lot of that will come down to, I think, these conversations that we're having, which is, what are the funding mechanisms? What are the priorities? How are we making sure that we're building those into the capacity plans to make sure that as many entities as possible are able to be having this impact and this effect. Anna in the chat asked a great question, which I think about quite a lot, which is, how do you see the role of INGOs when the power is shifted to local organizations? I think some of you touched upon that a little bit. Adam, you mentioned that this mentorship role may be around for quite a while. I think that may be one model. That's something that, as my involvement in the TIME project, Transforming INGO Models for Equity, is thinking about quite a bit. But I'm interested to hear all of your thoughts. What is the role of INGOs as this process happens, and when the power has shifted, if we can ever say that it has officially done that? Mounia?
I was just going to say that, and Cissy alluded to that, that, you know, as GSI, with some of the organizations that we previously worked with, we've now become a sub. So our role, you know, subbed for, so we can continue to work together and mentorship and just, you know, being, so there's a role, you know, at the end of the day, there is a role for us. But, you know, if ultimately there isn't, I mean, that's the way it should be, right? We then have to find a way to rethink, you know, what our objectives and, you know, what what we want to do, you know, as an organization in the future. But that's the way things are moving.
Cissy, Elton, Adam, any thoughts on that? Any opinions or projections on the role of INGOs?
Yeah, you can proceed, Cissy. I'll come up to you.
I think, as Mounia said, there is still a role in the near and mid-term in terms of supporting or mentoring. You know, when you build capacity, you also have to mentor. That's why I say, when you document what capacity you've built, you might come back after 1 year and that capacity is not there. But because we don't document and we put everything, you know, grossly, we just say, oh, capacity building has been, you know, enhanced or strengthened. But things have to be continue and even grow beyond what you have done. And it should be seen, you know, progressively increasing the strength of these organizations. So the mentoring aspect, even for organizations where you have done the capacity building, the mentoring is the continuing relationship to make sure that the capacity that you've built is ingrained into the institutions and it continues to grow, because it can fail to grow, whatever you have built. So I think you still have a role. And also, as we implement these programs and shift, it is not completely 100% shifted to local organizations. So international NGOs still have a role there. Yeah.
Yeah, I think there is the role of mentorship, and given some environments like ours, it remains important. The process, I think, of transfer to local leadership, it really requires that mentorship. And in some cases, you may actually be building capacity for people, for individuals, and then they move to other organizations. You sort of start again. But I think with time, even if this happens, with time, there is something that usually happens. The organization becomes known for something. For example, in our country, TB, in the country. I think Africa Invest is getting known for working on that. So with time, you start to attract people who are interested in that. We have had, because we also have a school of public health. We've seen a number of people who come in asking to start this and also to major in that area because of the work that we've been doing. The TB Echo allows us to meet about 89 to 90 hospitals every week. So that's quite huge, and that attracts the kind of skills that we think will be important for the future. Thank you.
Great, thank you. And so
Thank
what
you.
I'm hearing is these concerns as well.
Point, Kim.
Sorry, Adam, go ahead.
Okay, so I just wanted to say that I'm looking at shifting the power as work in progress. So most of the INGOs should not see it as immediate. There's huge opportunity there for NGOs, international organizations to still perform. So it's work in progress. Yes, PEPFAR, USAID are on that road, but it's a very long journey. It's not going to come immediately. So there's, like I said, mentorship is a big opportunity. Thank you.
And so one kind of takeaway that I'm hearing from you all is yes, the scaling. How are we scaling this? And thank you, someone, Bonnie put a resource into the chat here. But also, how are we maintaining and sustaining? Capacity is not a check the box, we've done it. It's something that is a long term. And what does that look like? Both in terms of projects, funding, relationships, partnerships, all of this. How are we building a community and an ecosystem where we're all learning from each other to maintain and sustain the work that has been done? I'm going to go ahead and Benedict, I see your hand raised. Do you have a question?
Yeah, thank you very much. I'm sorry, the network has been really disturbing me. I'm connecting from South Sudan. Do you hear me? Okay,
Yes,
good.
we can.
I know if I said this, maybe it could have already been said because I've been on and off, but just wanted to say one thing to add on what it has been said about the capacity building in terms of human resource. So my experience in South Sudan is that, yes, whereas international organizations build the capacity of this, more especially through mentoring and so on, the capacity of national staff in national organizations, they often, of course, recruit them later on to become staff of their own organizations, which is not bad. But then, of course, the circle of doing capacity building will continue because the same organization will be incapacitated in the year coming, or else you even remove them from your partnering, from your partnership in the claim that they don't qualify now. Yeah, why then, my question is, why then don't we emphasize on building the capacity in terms of the remuneration, the same salary that you attract this person, that you have built a capacity to your organization? Can't we, as part of the support in terms of financial support, put it in the national NGO to make sure that this person can hand that salary and remains there, well knowing that these national organizations are there forever. So once this person remains there, we have had an example where some of them, actually, we have built the capacity, have moved to another national NGO, retain themselves there, and then everybody's running to that national NGO. That's the best one. That's the best one. It's because same person will build the capacity, but they just consistently remain with in those organizations. So what I'm saying is, one, I know one of the problems in the capacity building we talk about in all these proposals, when you put about capacity building, the budget is ever reduced or it's never even accepted. But you find the donor wants you to build the capacity of local organizations. But then there is no budget. They say, but you need to build a capacity. So we need to increase the budget in terms of, in this area of capacity building, and most especially a budget that can support retaining of those staff in that organization that we have built the capacity for. So I'm sorry, I might have been repeating what has been said, but I put in the chat box, I go off network, it disappears still. So I just didn't want to end up this call without really saying something. Thank you very much.
No, I mean, you asked this. We could talk about this topic all day. I'm seeing head nods and I'm seeing laughter from the panelists. So I think this is a pain point we all feel. It's a wonderful question. I think it touches upon a lot of the things we've been talking about today. How do we maintain and sustain? how do we scale if the way that the system is set up incentivizes such high staff turnover and such high movement from local organizations to INGOs if we're supposed to be shifting power the other direction? So I think there are barriers, and the system within which we work has not yet been recalibrated to incentivize the other direction. And so I think the question is, what are the longer term, and you've brought it up a few, how do we change the way that the funding works and the way that the incentives work, but what also can we be doing in the short term to acknowledge and to work within what we have? I'm opening it up to the group. I saw a lot of smiling and head nods. What are your thoughts and reactions on that?
I think we'll leave Mounia to answer that.
Yeah, it's a difficult question, right? It's something we've all experienced, and you know, there's no easy answer. But one of the things that I've seen is that you know, I've seen this one organization that was getting ready to become a prime recipient through transition awards, and the donor was requesting a certain level of qualifications that was quite, you know, only a few people have. And so that was probably from the donor's perspective, trying to say, this is what we need in order to do the job efficiently. But then the qualifications were quite high that only certain few people could, you know, respond to that. And what that does to an organization is that they have to break their HR compensation policy and go and recruit that person just for the purposes of the project. But then beyond that project, that cannot be sustained. And that also creates internal, you know, tensions within the organization with staff who've actually been there from the beginning, who have taken the organization where it's at right now. And that's a challenge, and that's part of the, you know, the dynamic of the, you know, perhaps educating the funder into some of those like challenges that we're all experiencing, you know, whether it's this aspect of the requirements in terms of HR or the regulations that we all have to follow, whether we're the INGO or the local partner. I mean, those are challenges that we have to deal with. And that's the structure and system that, you know, in my view, needs to change.
I agree with you, Mounia, and I don't know if you want to volunteer to talk to the funders. But these standards are set like that, and they'll say we want someone with 10 years experience. And you say, okay, we are just transitioning from localization to localization. Where do we get 10 people to be chiefs of party that have had 10 years of experience in doing this work? And yes, so we all go and compete for the same person, and then they just double their salary because they are on market. And then you want to get the grant, so you have to recruit these kinds of people. So this is really difficult. What you have explained is very clear, and you are taking on this program and you have staff who are getting a different salary scale, and now you have to give a different salary scale. But I think Benedict, the other issue he was referring to was also, as international NGOs, when you come into the country, you also go for the best. So you pick the best from our institutions, even those ones that you have built capacity, so that now they are upgrading. And so you see, you still have a role. As people are moving up, others need to be supported. And we should actually, I think, do the capacity building at different levels so that we have many potentials that can move into these positions. It could also be, this was my opportunity. I've been working here for this time. So the person above me has moved. I also take this opportunity, but then I need a certain level of capacity strengthening to be able to be up to the game for that position. Yeah.
And Cissy, you say, I mean, yeah. Humentum has taken it. We have said that yes, we are volunteering to speak to the funders on these issues, and these are many of the issues that we work with on a regular basis. Key personnel requirements, compensation approaches and being consistent and equitable and what that looks like. And I think it's an interesting conversation, not just to say how are we being equitable within our organizations, but how are we being equitable across the region, across the local market, across the broader work that we do, if our broader goal is impact. And I think it's a two-pronged approach of having the funder conversations to change the ecosystem within which we work. But then, yes, also let's have the conversations amongst ourselves. And Robert here in the chat is saying something around the lines of culture change. You know, how are we making sure that we're having those mindset shifts at all levels of the organization so that we can be making these decisions? I'm looking at the time here, and I want to end with your last thoughts, all of you. Final thoughts, rapid round. So your quick kind of first gut reaction when I ask this question, which is one thing that you think the audience, the participants should take away about the relationship between capacity strengthening and locally led development, and or what is your call to action for INGOs and funders? What's your one thing that you would hope people would take away? And I will go, let's go in the order just on my screen. I see Cissy, I see Edem, I see Mounia, and Elton just dropped off. Hopefully he'll be able to come back on.
Okay, I think, first of all, we thank the international NGOs because a lot of capacity has been built, not only for these organizations that are represented here, but many others. And we are able to do many more things more correctly than we did before. So we do thank the capacity that has been built. And what we are just saying is that you still have a role to continue supporting us, because beyond the big NGOs local that you have supported, but also how do you support these local NGOs then to support other local organizations in the country. And again, if Humentum can help us, talking to donors, that the capacity that is built is not just for these programs today. It should be comprehensive so that local institutions have the capacity for sustainability, because today it's PEPFAR, but tomorrow maybe it's not PEPFAR. And the second question was about what?
I think you got it. That was your call to action, right? To
Okay,
INGOs and funders.
And for us as local organizations where capacity has been built, we have to sustain. And I think we have to document what we are doing and how we are sustaining this capacity, because that is how we will remain sustainable. Thank you.
Thank you. Adam?
Yeah, thank you very much. I appreciate the opportunity to be on this webinar, and I'm grateful to all the other partners that are here listening. The time has come where capacity that has been enhanced in local organizations has to be put into practice. So this is the time where organizations like JSI have actually led, the way by enabling some of us to do what they have taken us through over a long period of time. So yes, they still have a role. It's like, we are now going to be leading the pack, but they are behind us, moderating us. Do it this way, do it that way, or they wait for you to do it. Certainly, there will be mistakes along the line, but the role of JSI is to come in handy and correct us in this journey. So up until this point, stakeholder involvement in capacity enhancement is key for sustainability. And as local organizations, we have gone very far in this by co-creating, sustainability plans with communities and involving key stakeholders, because take it or leave it, donor funding is not going to be around forever. So community involvement, stakeholder involvement, and localization is the way to go. Thank you very much, Kim.
Thank you. Mounia and then Elton, what are your final thoughts and final calls to action?
I think for me, you know, the capacity strengthening is a long-term process, right? It's about a long-term relationship between the INGO and the local partner, and that is something that doesn't stop with that 5-year project that's being implemented with a very, you know, very specific mandate. Understanding that it's a continuing process of working together in a different partnership, but still they're, you know, working together in the medium term, as my colleagues have said, mentoring, partnering. And that to me is the key word, is really building between the INGO and the local NGO, that strong partnership, and taking the time at the beginning to, you know, invest in this and making sure that there is that relationship from the beginning, and that said that it's the most, you know, in the long term, it will work better.
Okay, from my side, I would say, I think resilience on our side is what we are focusing on, to make sure that despite the challenges, we remain doing what we are doing. I think capacity building, we believe that this can only come if we remain committed and we are on the ground. You start to attract the right skills, which has been happening, but at a very slow pace. Once you get the right skills, you can then be able to expand, and that's what we are focusing on. In terms of sustainability of what we've been implementing, it remains one of our priorities to ensure that whatever we have started does not die down. It sort of lives on, and to also not to focus on sort of one source of funds, but to see if you can also broaden the horizon where possible. With the related organizations, one could continue applying for grants as well, a skill that we have been already capacitated by JSI. Thank you.
Thank you. Thank you all very much. Thanks for this conversation. Thanks for the work that you do. Thanks for dedicating your time and sharing your experience. It's been wonderful. I hope that those on the call have learned, and thank you all on the call for joining us. I'm going to put a few links here in the chat just for you all. You can follow along with Humentum's journey and the journey of our community, the insights, reports, etc., that we are posting there. And then we hope to see you for the rest of the series throughout the year, where we will be diving into all sorts of other topics as we shift from talking the talk to let's walk the walk, and how are we actually doing some of this work. So thank you all very much. I hope you have a wonderful rest of your day and evening, and we will see you next time.
Thank you very much, Kim.
Thank you all.
Thank you.
Thank you. Thank you, Mounia. Thank you.
Thank you.